My name is Dr. Brad Lichtenstein, and I'm happy to be here. Today, I want to talk about how to deal with the experience that we've been going through the past 18 months, or actually 20 months now, and navigating the here and now. And we're going to talk about some mind-body strategies for regulating ourselves during these times. So part of what we're going to be talking about today, I want to start by talking about what is loss and grief. How do we identify it? What happens physically when we experience loss, and how to recognize our thoughts around that, and learn why our brain has evolved to focus on fear. It has. It's a protective mechanism. And to identify strategies to help with feelings of control and positive actions for coping. So we're going to be addressing that. In this presentation today, I have a number of slides. I am keeping those in for this presentation. I will just touch on them and pass over them. So you will actually get a copy of the slides so you can look at those later. And I just like to start with this. Sometimes it's okay if the only thing you do today is just breathe. I can't tell you the number of times I say that to people, and yet they go, I know, but let's talk about that a little bit. A little bit about me. I have this here, and that's my wonderful cat, Murphy, who's sitting on me. I'm doing my meditation with my muse. You can see in that picture. But I was a part of a study, a joint study between University of Washington and Bastyr University back in 2006 to 2009, I believe, where I went to the bedside of hospice patients twice a week and did guided meditation. And I did this until they died. So I have done over 500 bedside hospice meditations. And the thing to remember about that is I was working with individuals who knew what was happening. So it wasn't some of us who say, oh, well, will this change or that change? Or what if I do that? If I got to make the right decision? The people with whom I worked knew the end result. They knew that death was inevitable. But what we were exploring through my meditation, and we'll talk about this, is how do you want to be while that is happening? I think that fits with how do we navigate these times. So we're talking about loss and grief. And that's very different than depression. And that's important for all of us to remember, because a lot of us will sit there and go, oh, I've been so depressed during this pandemic. And maybe it's really loss and grief. Now, I used to teach a class at Bastyr for the undergrads called Myth, Ritual, and Healing. It was one of my favorite experiences at Bastyr. We looked at myths across the globe and across the centuries. You know, myths are these stories that we can use to relate to our own personal lives. We have modern day myths. We watch all those shows on Netflix, Hulu, and all your streaming services. We're looking for these stories that relate to our lives. And the reason I put this in here is that every myth and every story has about 3 stages. Some people break it down into 5, but the main 3s are there's a loss, there's a separation. And I'm going to go and explain each of these. After that loss or separation, we enter the wilderness, this journey. But in order for it to be a truly healing myth, there has to be transformation. How does this apply right now? How many of us are saying, I just want things to go back to normal? When is it going to go back to normal? Well, things go back to normal, the exact way they were. According to myth, there is no transformation. And I tell people all the time, I hope we don't go back to normal. I think our normal is what got us into some of the situations we've been in right now. Not necessarily the pandemic itself and COVID, but the state of our world. So what are each of these? With the loss or the separation, it can happen in an instant. It's not often a slow process. It is a diagnosis that a loved one gets. You're sitting there in the office, you might have suspected certain things, but then you get the diagnosis, you get the news, and that thing comes down. It's loss. It's a separation from your old way of looking at the world. Now, sometimes we get diagnoses, we hear news, and it really doesn't cause a shift. We're talking about loss is when there's a shift. The way I have been is no longer the way I am going to be now. And we talk about this as the 5 disses. Disengagement. You get disengaged from the way you've been interacting with the world. The pandemic has done that with us. Disidentification. Who am I? Who am I? How do I orient in the world? I don't know how to relate to that anymore. Disillusionment. In healthcare, there's disillusionment with providers, with science, with research. The way we've been thinking about the world changes. Disorientation. This one's really interesting because a lot of the people with whom I work, when they start to question how they're looking at the world, they say they feel disoriented. And I think that's a positive sign in that we're not going by rote. We're not going by automatic. We're starting to say, I have to reframe my whole experience of life. And then disintegration, things that we think make sense, how we hold the world together starts to crumble. So this is what happens in loss. Think of how that happened in the past 20 months. Again, so much has happened in the past 20 months, not just COVID, but it all spirals and connects. Are you feeling any disengagement, disidentification, disillusionment, or disorientation and disintegration? That's part of loss and grief, not necessarily depression. Now, once that happens in an instant. We get the news. We're on lockdown. We get the news. There's a virus that's here now. We get the news. We or a loved one has had COVID. Now we're in the stage of wilderness. And this is where we don't know how to make sense of anything around us. It's like we're scrambling to get some sense of orientation and identification. And in this place is when we must rely on resources, external resources, other people, our friends, our loved ones, our cats. My cat is sitting right over here, so we might hear her. If you know, just an aside, that the animal shelters have had a boom in business during this pandemic. We need resources, but our own internal resources, our own strength, what do we believe in, our values, our own daily practices, self-care. That's the only way we get through the wilderness is with our internal and external resources. And many times we forget about our internal resources. We forget about the practices. We're just saying, I want to get back to normal without thinking about that. And that's what we're going to talk about in a bit too. And then, as I said, there is no transformation if we just go back to the way things were with the same understanding, with the same identity, the same worldview. So when we re-enter, when the prodigal son returns, hopefully different, changed by that experience. And so it's also important for all of us to think about, as we come out of lockdown, be careful to say not come out of pandemic, because who knows what's going to happen next. But as we come out of this lockdown, as we start to go back into other things in our daily life, how different do we want to be? What resources and skills do we learn? How did we learn to orient differently that we want to take into this next part of our lives? So just some definitions of grief. Grief is loss, the actual loss or the potential loss. And as you can see with these different definitions, it's not just of an individual. Grief is not just the loss of a loved one. It can be anything to which we are attached. So we grieve, according to John Bowlby, who is the founder of attachment theory, because we are biologically willed to attach. But grief can also be loss of function. It can be loss of ability, loss of, back to those disses, our identity, how we orient to the world, those things we think will keep us safe. So grief can present in so many different ways. And it's very important as caregivers, as advocates, as providers, to remember we do not determine what the other person is attached to. And as any of you may know, not just with this pandemic, when a loved one dies, when I'm thinking of one of my cats, I thought that I understood about his health condition. I was ready. And it caught me off guard how much grief I felt. So we often don't know, but as advocates, providers, healthcare practitioners, we want to remember we don't determine someone else's attachment. And so to separate the depression from the grief, we have to understand how they are attached. And that third definition here, it's a crisis in meaning. How does that function, that pet, that job, that loved one, give meaning to our lives? How does it help me orient in my life? And I think that is something that each provider, each caregiver needs to ask, specifically ask, so that we understand if somebody's grieving. And grieving is different than mourning, according to some definitions. Grief is the reaction, which we're going to talk about in a second, and mourning refers to, that says reactions. There's a typo there. Reactions experience. It's the process that we're going through is mourning, and grief is the reaction. And so this is just a list, and this is not by any means a definitive list or a comprehensive list. What are our grief responses? We could be numb, we could have shock, we could have anger, anxiety, loneliness, fatigue, yearning. A grief response could be relief. I don't have to deal with that anymore. So sometimes when we are coming out of that wilderness and we feel such relief when a loved one dies or something happens, we go, oh, wait a minute, is that appropriate? That sense of relief, which can overwhelm us at times, can be a grief response. So these are the feeling, affective things. Physical sensations, again, this is just 4. It could be anything: tightness in the chest, shortness of breath, dizziness, lack of energy. And the flip side of all of this is an increase in energy. We feel grief, and thinking of my mother, or my father, can't sit down, have to move around, have to clean, have to put everything in order. Again, it's about creating meaning. I need things in order because that thing to which I was attached, that person, is no longer here. I don't know who I am. I'm going to go back to the things I know. I'm going to clean. I'm going to put things in order. So it could be lack of energy. It could be a huge mobilization response. It could be panic attack symptoms. Those are the common ones that people know. But numbness in the fingers and toes, that connects with hyperventilation syndrome. So there's a myriad of physical responses. And what I didn't put here that's very much lacking is digestive complaints, from as simple, what I say, constipation and diarrhea, but to all kinds of GI upset, lack of appetite, increased appetite. So those are the physical ones. And then, of course, grief responses. When the trauma, the grief, the separation happens quickly, of course, there's confusion and disbelief. Goes back to those disses. Where am I? But when there's a loss of a person, some of the grief thoughts could be sense of presence of others around us. And of course, lack of focus and concentration. I want to take a moment, it's not on the slides, but I want to talk about our cultural belief about grief. And actually, I am going to get to that. I'm going to hold off. I said I was going to say that here. I'm going to say it in another slide when we get to that, about cultural attitudes towards grief. And let's talk about grief behaviors, sleep disturbances, hypersomnia, sleeping a lot, not sleeping at all, appetite disturbances, withdrawal from people, which is very interesting. When grief happens, the very thing that is going to be healing, which we'll hear about later, is connection. And what do we often do? Isolate. Often we think no one will understand, which is very interesting. I hear that from people all the time. And I often want to say, hey, can I have you talk to the person I was just talking to? Because we're all saying that. Dreams of loss of the individual. But again, even if it's about someone who has died, dreams of loss of that connection, not just the individual. And then absent-mindedness. And absent-mindedness fits with the neurobiological events that happen when we get triggered in this way. Part of our prefrontal cortex goes offline. It is a neurobiological thing. So this is where I want to mention that thing I was about to say about grief versus depression. The DSM is the Diagnostic and Statistic Manual. It's what psychologists, psychiatrists use to diagnose mental health conditions. When the DSM was first created in the 1950s, when someone had a loss, which was called bereavement, grief, the span of time that it was considered to be acceptable was 2 years. I find this very interesting. DSM-2 came out, then it was down to 1 year. DSM-3, and I think this is about time span. DSM-3, it was about 6 months. And then DSM-4, bereavement was considered acceptable for 2 months, 60 days. And the reason this is important is after 60 days, on the 61st day, if your child died, if your spouse died, if your cat died, if you lost your job, that's still bereavement. At 61 days, it could then be categorized as depression. And then we know what we do with depression. We can medicate it. This is, I'll just say this here, this is absurd to me. This is absolutely absurd because if you look at cross-cultural studies, cross-culturally around the globe, grief is about a 2-year duration. We also find that if people do not experience signs of grief within the first few months of the experience, that it can become intractable chronic grief. And there is a difference between chronic grief and that acute grief. And why I'm bringing this up here is because I think there's a cultural bias that we have, that we're not supposed to grieve. Or if we do grieve, we're depressed. And I'd like to change that nomenclature. I'd like to change that language so that we recognize that it's not the same. So as you can see with this, we have here that grief can be experienced in waves, as anyone who's grieving knows. I remember being at my father's funeral at service, and we're talking with my relatives and we're laughing. Do you remember when he did that? And we're laughing and then we start to cry. It is that roller coaster. With true depression, those feelings are static. With grief, it can diminish over time, but with true diagnosable depression, it seems to be consistent and a sense of depletion. With grief, unless there's survivor guilt, that's a different variation of grief, we usually have a healthy self-image. With depression, there's a sense of worthlessness, a disturbed self-image. With grief, we often have a lack of feeling, although that can come in waves, and that happens in depression as well. With grief, there can be a little sense of hopelessness. I lost my job, I lost my sense of smell, and all of that's connected to the pandemic and lockdown, right? Lost my job, lost my sense of smell, lost my community, lost my loved one, and I can feel hopeless. I don't know where to go, what will happen next. With depression, it's more pervasive. And with grief, typically, when we have support, it helps us. And many times in depression, we don't feel responsive to that support. In depression, anger is not often pronounced. There's some forms of depression that it can be, but not overtly. And with grief, there can be a lot of expression of anger. I remember after my father's funeral, and I was cleaning up his office, and I was talking to him. I was like, why did you leave it this way? I was very angry at my dad at the moment. It really wasn't about his office, obviously, but signs of grief. And as I mentioned about survivor guilt, there can be some guilt focused on the aspect of loss. Why me? Or why them and not me? But with grief, we don't feel usually a sense of humiliation and demoralization, where in depression that often is quite pronounced. With grief, there's a preoccupation with the loss, I should say, not just the deceased, but with the loss. Grief often has rare suicidal expressions or gestures, except I'm thinking of those old movies that we see where the spouse jumps onto the coffin as it's being lowered. That is not usually what we see. And grief often elicits that feeling of sympathy in others who hear it, concern and desire. Whereas prolonged depression can, for lack of understanding on the part of the other people, elicit irritation, frustration. So different authors say that when we are grieving, when we are experiencing loss, again, those words, loss, part of our tasks are to accept reality. That is very hard. And there's a lot of mindfulness techniques. There's a lot of forgiveness meditations. There's a lot of practices in forgiveness, which isn't about condemning or condoning what happened. Forgiveness is about accepting reality. How do I sit and say, this is what happens without ruminating? Because we often go back and ruminate, if only this happened, and if only this happened. So we have to accept the loss. Then we have to work through our pain and adjust to the environment where that loss exists. How do we do that now? And with the loss of a person, we emotionally relocate the deceased or that function so that we can move forward in life. So again, none of this is about forgetting it, negating it, abandoning it, and in no way are we saying get over it. We're not saying get over it. We're saying, yes, this happened. How do we move through it? And there are tasks for the grieving to do physically, which is address our own body needs. If you're not sleeping, if you're not eating, we still have to address our body. We have to maximize our sense of safety. And think about this pandemic. It created issues of safety on so many levels. Safety of going out and meeting other people, safety with breathing. And then we can take it bigger than the pandemic. We can talk about social justice issues that arose during this time too. Breathing was a big thing. Are we able to breathe? So we're talking about feeling safe and autonomous. Just today in the New York Times, there was an opinion video about sometimes giving up is good. And maybe we should move on and maybe we should start saying, hey, I'm going to quit my job. As I was watching that video and they were talking about all the injustices in the world and maybe it's time to say we need to live differently. I agree, we do. But at the very end of the video, she said, but some of the individuals who are watching this might not have any options. And that's important for us all to realize, especially when we talk about advocacy for other people. Underserved people do not necessarily have the options of quitting that job and finding another one. So we have to recognize how some of this psychological safety comes from a place of privilege as well. But again, we can't look at another person and know how safe they are feeling, especially when we know about the rates of domestic violence that are happening. And now we're locked down with people that might be our aggressor. And of course, legally, emotional abuse, little we can do about that compared to physical. So psychological safety, I just want to mention that. And then if we're all isolating, not just distancing, but isolating because we feel that we're damaged, we're not doing well enough, we're not able to share this, how are people going to look at that? Then we retract further and we stop connecting. I know people for whom this lockdown, this pandemic was enlivening. They connected with family. They connected with other people through these media, through FaceTime, through Zoom, and they felt more connected because they didn't have as much time to do that. I know other people for whom that is completely the opposite. So social interaction, we have to address our social connections. And especially if it's a loss of job where you got your connections with others, and that was your main social support, that can be very trying. And then we have this idea of we have to address our spiritual needs. This is not the same as religious. I also taught at Bastyr another class called Psychology and the Soul. And we talked about spirituality, and there's so many different definitions of spirituality. And the one that I like to discuss with everyone is meaning and purpose in life. Because that is, in the research, one of the definitions, one of the quadrants of what spirituality is. It doesn't just necessarily mean a connection with higher power or connection with the environment. It's about having meaning and purpose. And as I said, with those 5 disses, when a separation happens, we can lose our sense of meaning. Who am I? What am I supposed to do? How do I create hope in my life? We have to address that. So these are the tasks. I'm going to show that last slide again. We need to accept. That's a spiritual practice. How do I accept? It's about mentally saying, this is what happened, and I'm not going to go back and relive it. Because often when we go back and relive it, we're debating with reality. And as I say to my patients all the time, when we fight reality, reality always wins. We often go back and say, ooh, that didn't happen. So we have to accept. That's a mental, psychological process. We work through our pain. That's a mental and emotional process. We have to adjust to the environment. Again, a cognitive process. These are mostly cognitive and emotional. But let's not rule out, we have to address our physical as well. Are you sleeping? Are you eating? This is why I like the Jewish tradition in which I was born. You know, someone dies, people send you food. But just thinking about this pandemic, my mother passed away in January. No one could be there. And when I was grieving, and we did do a Zoom service, you know, I had to make my own food. And my good friend's mother died a month before that. And this was in December during the pandemic. I was like, where do I find bagels and lox and schmear? And I was like driving around to find them, because that's what we do. Again, so addressing the physical. But do you see how all of these are connected, and how I couldn't even do my normal grieving process? And we have to acknowledge that. So as you can hear, there's a theme here. And it was in those 5 disses about how are we orienting. This is how I start with all the people with whom I work, even in meditation, in biofeedback work that I do, in counseling work that I do. I ask, how are you orienting to the world? And orienting is about how you're looking at it. Are you looking at it as a threat or as something with which you feel safe and can engage in? And those are the broad strokes. In somatic psychotherapy, we talk about defensive orienting strategies and healing orienting strategies. And I'm going to show you that in a moment. But going back to what I said about our culture, if the DSM, if a diagnostic book that labels people with psychological issues said, after 2 months, if you're still grieving, you might be depressed, let's treat your depression, that has ramifications in all our culture. The DSM-5, which is the new incarnation of it, by the way, has removed that 2-month. I should have said that. It removed that 2-month limit, recognizing that everybody grieves in their own way. But this whole thing about orientation speaks to our culture. How is our culture orienting to grief? Are we allowed to cry? I remember working with a gentleman who was 7 years old, and he was diagnosed with cancer. And he was sitting in front of me, and he started to cry, and he did that normal thing that we all do when we're sitting in front of other people, even if it's a therapist. And they went, I said, what are you doing? I said, well, I'm afraid I might not cry right. And that breaks my heart every time I hear that. He was afraid while he was grieving the loss of function and the loss of his cigarettes, because he gave them up that day. Who am I without this? But also the bigger issue of like, am I allowed to grieve? How am I orienting to feeling grief? Now, this slide talks about the defensive orienting response. And this is just more of a neurobiological thing. You don't need to really know this. The point I want to make is that when we have grief or loss or trauma, it's not all sympathetic. And a lot of people do say it's sympathetic. Oh, your sympathetic nervous system is firing. But we have 2 defensive orienting responses. We have the one where we get highly mobilized, like I said my mom did, and she would start to clean and do all of that. And then we have that part where we shut down. We go inward. And with grief, as I said, it's cyclical. It goes up and down. It's like a roller coaster. You can shuttle between both of those. And then when there's danger, we usually activate more. When we feel like there's an immediate threat, we usually shut down. It's not necessarily important to know for this conversation, but this goes back to the healing orienting response and connecting socially. The thing that helps all of us is making social connections. What's very, very disturbing is that in 1995, if you ask the average American how many people you could call, the average person in the US, I should clarify, in the US, how many people you could call if there was an emergency? The average person in the US had 1 to 3. In 2005, the average person in the US said 0. Now that was a poll, who knows who they asked, but that is very disturbing. Because what's that say? The thing that heals, this healing orienting response, connecting with someone that regulates your vagus nerve, your 10th cranial nerve, that regulates your nervous system, your parasympathetic nervous system, and allows you to heal. That's what it gets engaged whenever you get a cold or a flu. To heal, you don't feel like you're having a lot of energy, you feel tired, lethargic. That's your parasympathetic kicking in and saying, just rest. It also helps us connect with others. And what are we saying? We're saying, I can't talk to anybody. I need to separate myself. I don't want them to know what I'm going through, because we feel shame and guilt about grief and loss. And I'm asking us to reframe that. So the very thing that helps us, and that's why this pandemic specifically has been challenging, because it's created more distance. And so there's just pictures of animals connecting, the zebras, and just more. All animals, all of the mammals know how to do this. You see this. And actually, when you see the baby sloth on the mama's back, and you see the gorilla holding the infant, and you feel that, if you do, and you see your body, feel your body smile, that's engaging that vagus nerve. That's engaging that. And when we practice that, even just thinking about those that we love, as long as we don't let it spiral off into, oh, but they're not here. Oh, no. If we can hold on to that feeling, we can connect. I'm jumping ahead a little bit. So this is important because for advocates, providers, we need to be resilient. And why is this important? Because if we aren't, when we have lack of resiliency, it affects our physical, mental, and emotional health. It leads to burnout. It affects our empathy, and we lose meaning in what we're doing. I'll show you with here, there's 3 domains of burnout. Depersonalization. We start to become less sensitive, and we say, do I care about these other people? I care less about the people I'm working with, and for. And then there's emotional exhaustion. You feel less engaged. You're not as excited about your work. And many times you say, am I really helping at all? This is important. Is this depression? Is this burnout? I think burnout is loss and grief. And so what are the main factors? I just have all of these here because it's interesting. If you look at the main factors of burnout, only 20% of it has to do with the actual, for practitioners, for providers, advocates, only 20% has to do with the engagement with the other person. Most of it has to do with the institution, with the paperwork, the time constraints, the work environment. And that's the problem. And I know we're speaking to advocates, talking about advocacy, just trying to navigate the healthcare system. Talk about a chaotic environment, lack of control, and time pressure. So it's important to address all of these. And so what is resiliency? I know I said that word. It's the ability to bounce back. It really comes back from the word resile, to jump back. And what are we jumping back? Jumping back to adaptability. There are several types of resiliency. There's natural resiliency, and they say that's what you're born with. Okay. It depends on your birth, the state your mother was in during pregnancy, at least the 3rd trimester, because those cortisol and stress hormones can impact your natural resiliency. There's the adaptive resiliency, which many of us learned. We don't know what we'll do until we're in that situation. It's the test by fire. We can't predict it. Then when we're in it, we find out how we adapt. But restored resiliency, and that's why we're talking about this, is that's what you can practice. That's what you can do with daily home activities, with practices, with meditations, with keeping schedules. There's something called hardiness, and I'm going to just go through this very quickly. Hardiness is what they used to talk about. I know I'm jumping through the pictures. What they used to talk about with resiliency. And hardiness really is our ability to have commitment to our life where we actually can see ourselves as players, active players in our own healthcare. Advocacy helps here, right? So that we don't just take the word of the doctor and do whatever they say. We are actively participating in our own healthcare. Challenges where we look at the events that happen and change it from saying it's a threat, it's a danger, which starts that that defensive orienting response, to a challenge. Okay, what now? People who are hardy and have resiliency don't ask why me. They often ask what now. Just something to remember there. And the why me can be helpful if we go, well, what did I do? But see, that becomes a what question, not why, which is often about blame and shame. Control parameter is where, control parameter is where we realize I can't control everything that's going on, right? I can't control when vaccines will be rolled out. I can't control whether people wear masks. What I can control is how I view it and how I engage with it. That's very important. So it's not that we can control the environment. I mean, a lot of us wish we could. And then in the original studies on hardiness, it was just those three parameters. But as they did more and more work with hardiness, they found the last one was community. Without a strong sense of community, at least someone with whom you feel like you can call, many people lose that sense of commitment or challenge. You all have heard these memes, if you're on social media, I'm not, or other places to say, today, if this is your last day, who do you want to call? What if we put that into practice? Who do I just want to say, I love you to today? This was a resiliency scale. I'm not going to even show that. It talks about 25 questions that can be broken down into those 4 parameters. So of course, the patients I'm working with who have young kids were just telling me how they've been watching Frozen 1 and 2 over and over, and they would like to let that video go. But now we're talking about how do we do that? How do we work with loss? So as you saw, we have to do with it physically, mentally, emotionally, spiritually, but we have to address that meaning. We lose meaning. And so we have to talk about reconstructing our own narrative, our own story. And the first part is to really get comfortable with feeling grief. As healthcare providers, we have to get comfortable with listening to someone else's grief and not feeling we need to fix it, because we're not fixing it. And we can't say get over it. It's about how do we just sit with it. So we need to have practices for ourselves. And then when we can hold it for others, they can see that it's safe enough to hold for themselves. They can sit with their own grief. If I'm not going, I'm just staying with you. I'm not going anywhere. Yeah, tell me about that. So we establish and maintain empathetic attunement. We witness, we listen, and we normalize that grief reaction. Did you think that you're the only one feeling that? Oh, no, I feel that too. And then we convene these healing conversations. So are we able to listen and witness? That's the important thing. And so there's a number of questions here on the slides you can look at later too. But how do we co-construct a narrative? We're creating that narrative in real time. Social constructive theories tells us that the more we talk, the more we learn what we believe. So allowing people to share their narrative, they can create a new narrative. Tell me about your experience. Now, you don't have to take these are very static questions. How do you position yourself in this story? Rather, well, how are you the leading character in your story? How do others see you in the story? There was a study with Bosnian refugees where they put them in, they were in refugee camps, and they separated the refugees into two groups. One group, they said, you are going to see a psychotherapist to work on the grief. The other was told, you're going to see an autobiographer or a biographer, and they're going to take down your account and they're going to tell it to the world. Little did the people know it was the same psychologist. They were both seeing a psychologist, but that was a way of co-constructing the narrative. That the individuals then said, oh, I'm going to therapy to work on my trauma. Okay, I got to work with, there's something wrong with me. Let me work on this. Whereas when they were being told they were seeing a biographer, their trauma had meaning. Their loss had meaning in life. By our advocates, providers, practitioners, our saying, I am here and your story matters to me. It matters to me. You matter to me. Your life matters to me. It has meaning to me. We're giving them a sense of meaning. We're not trying to give it to them. We're saying, yeah, you matter. And then by mattering to the patient, we teach the patient individual to matter to themselves. So these questions are just some ways of creatively co-creating that narrative. How did you handle that situation? But we also want to talk about the downsides. Like, what was the biggest struggle with that? You're here, by the way, you're here today. How did you do that? What was the biggest challenge? Giving voice to all of it. So we're not just saying rah, 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 yeah, it's all easy. It's like, no, what was the biggest challenge? Studies have shown that when you talk to people about the biggest obstacle for them, they often feel empowered to address it. And this is coming from weight loss studies, like when they don't talk and they're like, wow, you've maintained your diet, good, keep doing it. What was the biggest struggle? People were able to maintain it more when they were talking about it. So whether it's grief, loss, talking to them about their whole story. What would you want to talk about further? What have you not told other people about this story? What haven't you mentioned yet? If your story continues, say we are telling this, you're telling me this as a story. If it was to continue, what would be the next part? Carl Jung said that one of the main problems in health, mental health specifically, but is a lack of imagination. Let's access people's imagination. We get stuck in that. So here are some other questions about co-constructing narratives. For us, as we're doing this, and to help the individual who's doing this as well, we have to know our own limits. It's so hard for people to say no. And I'm confused by that. Well, I shouldn't be confused by that. I should recognize that I do the same thing. Wow. This is my own therapy right now. Saying no, as I like to tell people, is a promise. Most people don't think of no as a promise. Saying no is a promise and saying, I am taking what you're saying seriously and I'm agreeing I can't fulfill your request. What would that be like if we started to think of no that way? Boundaries are important. Our skin is a boundary. Our immune cells are a boundary. It's saying, what is it? Oh, that's my hand. Come on in. What is it? Nope, let's push it away. We need to know our boundaries. And so many of us have shame around boundaries. And with grief, that comes up because we should be able to handle all of it. So we have to set our boundaries and then nurture ourselves. This is just one of many things you'll find on the internet. I took stuff from other areas and put this in to identify your strengths, but recognize your signs of stress. If you don't know what they are, you're going to get overwhelmed by it. They found that with that commitment, challenge, and control, individuals who didn't identify as just one thing, you lose your job, your life is over because you identify just as your job. If you're in that relationship and your life is just the relationship that's gone away, then you have no meaning. People who've engaged in meaningful activities that were outside of one sphere, who had multiple social networks, were more resilient. But also set an expectation for yourself. I've talked to so many people who say, I'm going to start meditating every day. And then I see them next week and they're like, I didn't do it. Oh yeah. It's like, what's a clear expectation? What are you going to do? 5 minutes? 3 times a week. Think of it as doing research. No researcher abandons the whole project after 1 week. They say, oh, maybe I need to make adjustments here. One thing, though, that really helps with resiliency and helping get a new focus is moving. Are you moving? Now, when we're in lockdown and we can't, connect with people, I know that's being lifted now. Are we going outside? Are we walking around our house? Are we just staying stationary? We already talked about addressing negative narratives by talking about co-constructing your narratives. And there's many other resiliency and regulation practices. I'm going to show some more. So there's a number of things here. This is something I do with all my people with whom I work. I have them make a psychosocial spiritual autobiography timeline. I have them take this timeline, as you can see on the bottom here, from 0 to your current age, and everything that they think has been negative in their life, they put in the line below, and everything that is positive above. And I have them think on this and reflect on this for a while, not just one day. Look at it, close it, if it's in a book, look away, come back, and then they start to connect the dots and start to see that they managed a number of things in their life. So it's just one of those things. And then they write a summary about this. Again, it's kind of like working with a biographer. We can look, when we go back to that, we can look at those things that we call negative events, but even the positive ones, and say, what has been most triggering and what have affected me? But how am I here today? I've worked with many people with very severe depression, severe PTSD. And I borrow from Viktor Frankl, who wrote Man's Search for Meaning, who was in the concentration camps and watched his family die. He would ask people, why are you here? And they would say, well, I'm really depressed. I didn't really want to come here, but you're here. Well, I have a little hope. And he said, where is it? Sometimes he'd ask, where is it in the body? This is in my pinky. It's like, let's talk to that. We often deny that. There's all other aspects to us. So what has allowed you to feel hope? What has allowed you to do that? Again, we're not negating the negative. And so there's more questions you can look at when you look at the slides about those experiences. And all of this, as I said, is spiritual because we're looking for meaning. And there is a Japanese concept that talks about doing what you love, but recognizing what you're good at. This is for work, about what you could be paid for and what the world needs. We can change those words around, but just talking about finding meaning and purpose in life. Do you have a purpose? Are you living purposefully? That means we can put our life into that practice. Something else I do with all of the people with whom I work is have them build a vision statement for their life. And that becomes the mantra we go back to. They use a bunch of words about their verbs that are meaningful to them, and then come up with others so that we come up with a mantra that they can use as their meditation. Again, finding meaning and purpose in life. And these are some other questions. So we already talked about some of that. The last thing I want to make sure we talk about is gratitude. The practice of gratitude is so important. We're not saying when we feel gratitude, other things didn't happen. We're talking about, what am I grateful for right now? All the studies that have talked about different populations, looking at college students when they split first year college, Psych 101 students into groups, and they had one group write down 5 things they did that day, and the other group wrote down 5 things they were grateful for. They found, and they were randomized, right? They found that the people who wrote things that they were grateful for had improved mental health outcomes, handled the stress of the quarter differently. And they've done this studies with so many things, people with chronic pain. So in no way are we negating the struggles of being in college or the chronic pain symptoms. We're just saying, I want to focus on what I'm grateful for in the moment. And I invite you to think about that just right now. What is one thing to whom, it could be a thing, it could be a place in nature, it could be a quality you possess, or it can be a loved one, something that you feel grateful, love, and appreciation towards. Most of us can't hold on to it. Most of us feel it. We can feel that change, and it regulates that vagus nerve that I mentioned earlier. It allows us to connect. It can allow us to smile. It regulates our heart rate. It actually does. We can talk about that another time. It regulates our heart rate. And that has consequences for how we relate to the world. I'm not saying that there isn't injustice and health and disease and destruction. No, but I'm still grateful for it. It allows me to orient to those things differently and respond to them differently. So write down in your gratitude journal. That's mine. That's my handwriting. No comments. And loving kindness. Loving kindness is just a different version. A friend of mine took this picture. She was on the beach and she found all these red rocks and put those together. Loving kindness is very similar. It's recognizing that everyone in the world wants the same things. It doesn't matter what spiritual tradition you're in. We all want to feel safe. Remember, we talked about safety. We all want to feel safe. We all want to feel healthy. We want to be at peace, meaning we're not fighting with reality. We want to live with ease. Whether you use those words that are classic in some loving kindness meditations, or anything where you're wishing other people that they feel safe, healthy, happy. We can even begin to do this practice for people who've harmed us, wronged us, with whom we have issues. That's a bigger skill. But we start by just finding love and appreciation, gratitude, and loving kindness. This can help us. So if you're struggling with healthcare system and navigating it, and you are on hold and all that, what can you be grateful for right now? When we can do that, we can start to regulate our nervous system so that we don't suffer from that phrase everybody here suffers from those consequences of stress. This is my biofeedback device. This is heart rate variability. We're not going to go into that, but just to show you, this is somebody thinking about stress and you can see what their heart rate does. This is them breathing in and out through their heart. Same person, just 2 minutes later. And this is them thinking of something they love and appreciate. And I know you don't know how to read this, but their heart rate's going up and down evenly with their breath in a regular fashion. This is what we're trying to cultivate. And that's all I just want to say. There is some science behind this. So love and appreciation, gratitude, self-care, nurturing. I offer free guided meditations. This isn't a shameless plug, but I do free guided meditations since the beginning of the pandemic. Since the pandemic started, I wanted to offer guided meditations to people twice a week, Mondays and Thursdays. This is my website, thebreathspace.com. And if you scroll down on the meditation page, I offer free guided meditations. And you can join me anytime at 8 o'clock on Mondays and Thursdays.